福利事務委員會嘅特別會議咧。
Members, good afternoon. May I call to order the meeting of the Special Welfare Services panels. As is the appointed time, we have formed a quorum. Members may recall that on the 10th of July, at our WS panel meeting, we discussed the Elderly Services Program plan. We decided to convene public hearing. 63 deputations and individuals are coming this afternoon. The first session is from 4:30 to 6:30. After a break of 5 minutes, we will start again at 6:35 all the way to 8:25 p.m. May I remind you that we have a microphone and also an earpiece tuned into channel 0 for the floor, channel 1 for Cantonese, channel 2 for English, and channel 3 for Putonghua. The administration is coming in, and I'll leave the introduction to a later stage. You will speak according to your seat number, and you have each up to 3 minutes to speak. May I remind you that your remarks are not protected by the alleged co-powers and privileges ordinance, and the same applies to your written submission. You will not enjoy the immunity and protection under the ordinance. You are liable for your own speech. And for those in the public gallery, please note that we have a guidance for members of the public attending a meeting of the council at the public gallery. If you need a copy, please approach our staff. For deputation individuals who have yet to submit a written submission, you may do so after you have spoken, and it will be circulated within the panel. We'd like to welcome the following officials from the administration, and they are Dr. Law Chi Kwong, Secretary for Labor and Welfare from the Labor and Welfare Bureau, Ms. Stella Zhang, PAS for Labor and Welfare, Mr. Lam Ka Tai, Deputy Director of Social Welfare, and Ms. Pang Kit Ling, Assistant Director from the same department. So I'll give the floor to the Secretary for a 5-minute introduction. Thank you, Chairman. I don't think we need too much introduction. On the 10th of July, we came to the Council to explain the Elderly Services Program plan to members. I understand that 65 deputations and individuals are here this afternoon to express their views, and I'm all ears to their comments. Perhaps I should leave time for them. Thank you. Our meeting is rather long today, and we don't want to extend it any further. So please observe the time limit of 5 minutes each very strictly, and I will enforce this very stringently. I'll first give the floor to Ms. Lee Choi Kwan. Oh, she is yet to arrive. Then Mr. Kwong Wing Tai, the Alliance on Concern for Home Care Services. Thank you. Although the ESPP is already completed, the policy objectives are not consistent with the aspirations of stakeholders. We are concerned about community care services. The government has overlooked the need of those with light impairment. I think CS should be both preventive and rehabilitative, and we should greatly increase the number of CCS. The ESPP agrees to this direction. However, for elderly persons with mild impairment, they are just regarded as regular cases under CCS, and yet the supply of services is inadequate. Many elderly persons have to wait for years before they can be served. Sometimes even they are served, they can only get part of the services they apply for. And this figure is not reflected in the number on waiting lists, and there are many elderly persons waiting for services. the number is much higher than the 3,700 as quoted by the WSD. We oppose the use of the CCF fund to address the needs of elderly persons with mild impairment. The government is using the CCF as a trial scheme to help them. Well, this is just old wine in a new bottle. You expect the heavily loaded working teams to serve them. You claim that it is for elderly persons with mild impairment, but the details are in the devil. The devil is in the detail. Now, to apply for these services, you have to go for a means test, and there is also co-payment arrangement. This is very different from the current CCS, and you're depriving some elderly persons of the opportunity for receiving services, and the services and support are not comprehensive. The subsidy is just for social welfare workers. Do you expect them to escort elderly persons to medical follow-up and to deliver meals? You haven't increased resources for supporting staff. Frontline carers are not calculated. Service teams have to face a high turnover of staff. As a result, current manpower is very tight, and the workload is greatly increased. Once you have joined this scheme, elderly persons may have to leave the comprehensive team. Your time is up. Ms. Lee Feng King. Thank you, Chairman. I urge the administration to face up to the needs of ordinary cases, and you should review the ratio. Now, for comprehensive home care services, the needs of ordinary cases have always been overlooked. Resources are focused on the frail elderly persons. And as for preventive support functions and to shorten the deterioration or to prevent the deterioration of the conditions of elderly persons while they're waiting for services, the projection and planning is such that the consultancy team use 100% reduction in demand per year, and this is unacceptable. So by 2046, service demand will be 120,000 lower than the actual requirement when it comes to manpower and land requirements. Now, for ordinary cases, the IHSC, you have just focused on education. You have overlooked the preventive side. And you have not included ordinary cases into the long-term care cases. According to the administration, because they have not maintained any data on this. Since you have got a new assessment mechanism, you have this simplified assessment form to look at the needs of elderly persons with mild impairment. Then you should consolidate these data and incorporate that into the total figure requiring services. Because the planning ratio is challenged by the public, we believe the projection is much lower than what we have here. In order not to affect the investment of resources in this area in the planning, in the coming 10 years, we should review the mechanism, and then we should take into account of factors overlooked in the past. For instance, the need of single elderlies, and this decision that there should be 100 reduction in the number in demand per year. And so we want you to review these factors first before you look at the projections, so that you will not be too wrong in your assumption, leading to social crisis. Thank you, Ms. Feng Miu-ha. Thank you, Chairman. Now, I would like to talk about the age limit on those who need long-term care. Well, for long-term care, I think you should consider the needs of the disabled as well. As our population is aging, more people require long-term care. This includes elderly persons as well as the disabled persons that are growing old as well. We have 580,000 persons with disabilities in Hong Kong, and some they are catching chronic diseases early in life. For instance, dementia. The youngest sufferer can be 38 years old, and so we should take note of this. For those who are 70 years old, 53% of them and 16.9% of the population are over 65 years old. So even our persons with disabilities are getting old. Since the consultation on ESPP have mentioned on various occasions that we should take into account the needs of persons with disabilities, PWDs as well. The reality is, because of the age limit imposed, PWDs cannot have access to services due to them, such as daytime care. Daytime care can only serve elderly who are over 65 years old. Those who are younger are denied of such services. They have to procure self-financing services, which is a big burden financially to them. There can be physical impairment as you grow old, and after accidents, you can have fractures. You may need walking aids and even wheelchair, and there are also complications of stroke, and that can lead to a lot of inconvenience, and Parkinson's disease and also dementia affecting younger people. So this can affect our elderly persons, so we should take note of this. We should enhance support for them. So we should improve services to the disabled as well as to the elderly. They should be considered together, and PWDs should not be denied of services because of their age. Thank you. Mr. Zhang Haipan. Thank you, Chairman. The elderly service, the CCS is not really sufficient for our elderly. Their population is growing quickly, and yet the situation is just the same, and this cannot be. We must introduce greater improvements. First, for instance, an elderly person should be cleaning surfaces at home, and he may have to wait for 3 years. He can't afford to wait that long. So he subsequently withdrew from the waiting list. I urge the administration to improve the situation as soon as possible. The waiting list is so long. There are already over 9,000 elderly persons waiting for services, and yet we do not see any solution. If you do not understand the situation, then whether we are retired or whether we are working, we think this is a problem. I hope the administration can face up to the problems. I have raised this a number of times, and there is the question of $300 million or $30 billion. Now we have so many people waiting for services. And how come this $30 billion is not spent to address these pressing issues? Many elders, they need services, they need healthcare services. And you have $30 billion waiting to be spent. I think this is very wrong. I hope the government can face up to the problems. It's not that the government is poor. If you don't have the money, then there is nothing we can say. It's not that you don't have the money. Even the government is telling us that they have $30 billion waiting to be spent. So why don't you spend that money at once to resolve the problem? This is clear. This issue of $30 billion having nowhere to spend, I don't know whether it has come from the administration or I'd like the administration to explain to us. Many people are asking how this $30 billion are going to be spent, perhaps on rehabilitation or some for elderly services. I hope the Secretary can respond to this point later. Mr. Seeing Lun, thank you.
Well, the Chief Executive, Carrie Lam, after assumed office, said that there would be more beneficiaries. We're unsure what the beneficiaries are, but there are victims. There are elderly people waiting for residential care services. Now, for the new fiscal philosophy, the government means privatization. That is, to outsource what the government is supposed to do. As for elderly users, they will be asked to scout for services in the private sector. In the face of such a serious problem, the government is taking part in the privatization process. For example, for the elderly care voucher scheme and also other pilot schemes, they seek to provide stopgap solutions. For example, vouchers for residential care homes and also community care service for elderly people with mild impairment. Well, like the government said, the services might be flexible. They might offer more choices for users. But is that really the case? Perhaps that may be so in major support centers. Now, the government introduces a scheme, but the government doesn't consider whether the organization has sufficient resources to support the implementation of the scheme. As we often say, we need sufficient manpower to implement the scheme. The cases that we heard is often that the organization may not have sufficient resources during their run-in period. They may apply for the provision of care service. The elderly users eventually just sit in the center all day because of lack of resources, and yet the users would be regarded as having been served. So only limited services will be provided. And for meal delivery service and other meal services, sometimes only 3 days of service would be provided a week. You may meet the criteria of flexibility, but what about the service needs? Now, in the face of the privatization of care service, elderly people suffer. Now, for ordinary people, they may seek other options, but for elderly people, their health is at stake. So the most important point of the ESPP is to be pragmatic. The resources for implementing pilot schemes should be focused on increasing quotas, places, and manpower. For new housing estates, there should be more teams set up to look after the elderly. Thank you. Thank you. You have a good control of the time. I recall the Secretary once responded that using vouchers does not mean privatization. I recall that he once responded something like that, but perhaps you can give a response later. Be it community care or home care vouchers, I understand that there have been views expressed. Next, Madam Lo Lai Ping from a concerned group in KWOK Estate. Thank you, Chairman. For the elderly people like ours, we don't agree with the privatization of home care services. Well, I took part in those schemes before. I heard that consultation will be conducted, and then you made adjustments to the schemes. I don't think this would do, because our elderly users are really in need of the service. They are in need of those services urgently. They should not be rolled out under the CCF, Community Care Fund. Rather, you should consider the practical service needs of elderly people. There should not be any co-payment system, because elderly people living with young family members would like to enjoy their family life. They do not want to be sent to a home. But then the whole family would need to be subject to the means test. It causes so much trouble to the younger family members, and it also exerts pressure on the elderly family members, because for the younger family members, they need to make their ends meet to look after the family, and at the same time they need to worry about their elderly. So we should do away with the screening mechanism and also the eligibility requirements, because elderly people are helpless. What we want is to enjoy our family life, so that we can enjoy our life in our dotage. Some elderly people may not be able to afford a home, and that's why they ask you for help. You should not put them through endless family meetings, screenings, to see if the elderly people are eligible for your subsidy. Sometimes elderly people would gather and talk about this. It's so cumbersome. On the one hand, they don't know which department to approach for help, and on the other hand, we understand that for home care service subsidy, you need to discuss with the family members, and you need to see if you're eligible. Elderly people are really frustrated and helpless. Well, like Madam Low said, the means test is the cause of conflicts in families, and it's also a deterrent for elderly to apply for the service. Right, understood. Next, Ms. So Simian. Thank you, Chairman. We believe the ESPP must include a regular review mechanism. Now, the government's consultation work has always been criticized. Be it the last occasion and also the ESPP consultation, the government was only going through the motions. The government did not listen to the public. In the consultation process, the government already had a preconceived stance, especially from the ESPP consultation. There was a so-called 18-district consultation exercise. But it was only done because of the pressure from the communities. And also, for many recommendations, they came as a form of preconceived stance. The government did not discuss other proposals floated in communities. Only an internal review would be conducted within the government. There is no platform to really listen to the views of the community. It's such a one-way consultation exercise on the government's proposal. It's just a shield or a response to how the government reacts to the community's proposals, not to mention providing suitable services to the elderly. We would like to have a regular review mechanism so that the voice of the community will continue to be heard in order to improve the plan. Frontline social workers, users, self-help organizations and groups should also be included as your consultation target. And you should truly reflect the views of stakeholders so that your plan can truly respond to the aspirations and needs in the community and the changes. We have actually repeated our requests time and again. I think that we're all frustrated after repeated requests. But the problem is, in the government's consultation process, our views have never been heard. And that is why I say once again that there should be a platform and a mechanism for consultation so that the views of the community can really reach the government. Thank you, Madam So. But I think you understand that for ESPP, they conducted 62 consultation sessions with 2,000 attendances. 130 plus submissions were received. But you still believe that the consultation mechanism was such that the views of the community weren't heard. I think the government should give a response, because the RPP, I suppose, would also base its consultation exercise on the experience of the ESPP. Perhaps we can further discuss your suggestion. Next, Mr. Ip Kin Kwan from New People's Party, or rather, Mr. Ha. I'm from KWOK Estate. It's a rather aged estate with an aging population. I have been there for 10 years. I've taken part in the district work, and I'd like to reflect the problems of elderly households and also those above the age of 65. Now, I can summarize this as the following. Point number one, as the other speakers have said, the support services have reached a saturation. According to the elderly residents, the waiting time is very long. And for example, in urgent situations, they may want the elderly centers to provide meal delivery service, but the service need is not met. And they might need to rely on part-time helps to deliver meals. And they're in financial hardship. The other point is this. Many elderly people may not be able to adapt to social changes. Many elderly people are out of touch with the community. Even if, say, the children buy them a mobile phone, they may not be able to use it. We have the public policies, we have the pamphlets with the details of the policy, but they are illiterate and nobody explains to them. And when they want to ring the hotline to ask for public utility services, all they face is audio recording, and they feel so stressed. Point number 3 is about self-care. They may not have adequate knowledge on their health, and whenever a health condition arises, it may be very serious already, and it poses great pressure on the frontline healthcare service. So if we address these problems, it will greatly help the situation. The New People's Party, starting in June this year, have been working with the Hong Kong Polytechnic University. We have trained nurses visiting the homes of elderly in KWOK Estate, and the nurses teach the elderly people basic health knowledge and where and how to seek help should they encounter difficulty. It's quite effective, so we would suggest that the government include aging in place in your plan, and more resources should be deployed to show the government's commitment and resolve. The government should take the lead in making a joint effort with stakeholders to improve the plan. Thank you, Mr. Ha. He raised an issue. Smart technology nowadays may not really help the elderly, but pose extra pressure. Madam Chen Kapui from Southern District Council. Thank you, Chairman. Elderly service for grassroots. At the moment, the government has voucher schemes, safety alarm, support centers, etc. These services target able-bodied elderlies. And at the same time, financial support is also provided to low-income elderly earners. These only meet their basic needs. We should take a macroscopic view of the elderly services in Hong Kong. We see no breakthrough in the elderly policy. We rely on volunteers to make home visits. I mean, not volunteers, but social workers. But we don't have sufficient social workers. As of December 2017, the total number of social workers registered was just 22,232, whereas for the elderly population, about 65, over 100, and in fact 1.1 million. So the social workers are far from sufficient in supporting our elderly population. About 10%. That means only 10% of the 1.1 million elderly population are looked after by foreign domestic helpers. Well, we talked about the concept of aging in place. I don't think this is the panacea. We need to take a multi-pronged approach. But one key policy that I firmly believe in is this. The government earlier rolled out an active aging scheme and also a neighborhood mutual help scheme for the elderly. These schemes seek to promote mutual help among neighbors. For example, recently we visited the housing estates with shopping malls managed by the Link REIT because the public markets are no longer there. The elderly people would rely on their neighbors to help with their shopping. I think the government should take the lead in formulating a policy promoting help in the neighborhood so as to make it a common practice, because many district and community organizations would form their own voluntary teams. Say for Kaifong associations, they have teams of volunteers visiting elderly people. But it's done on a voluntary basis, so it's difficult to, say, provide meal delivery service. We need the help of social workers. Whereas for the housing society, in recent years, you might be familiar with their scheme, building flats for elderly people. Like the Tanner Hill facility, the neighborhood also contains elderly-friendly facilities, and they will also encourage elderly residents to be more active and to take part in activities. We hope that this will also be promoted in private estates with the government taking the lead. Your time is up. Thank you, Madam Chan. You talked about social worker, the manpower of social workers. Next, Dr. Lau Siu Lai. Thank you, Chairman. Well, in recent years, we always hear this term, elderly tsunami. It seems that the government is is facing such a huge pressure. It seems that the elderly population is giving such an huge burden on the government, but it is not true. Well, even for other countries, population of the elderly is rising. In Japan, 23%, Taiwan 14%, Hong Kong 16%. So other countries also are facing the same problem. But the solution is this. In fact, if the government plans better with more resources, we can manage the elderly population better. The common trend is this. For many advanced economies, they spend about 2 to 3% of GDP to look after the elderly. For example, Japan 2%, Canada 3%, and UK 3%. But in Hong Kong, 0.3%. So we only spend 1/10 of the resources to look after the elderly, and we're labeling elderly population as our burden. It's so unfair. In the past, starting from Carrie Lam as the Director of Social Welfare, the government had been a Scrooge. And now Dr. Law Chi Kwong is a secretary, and it seems that the sector is left on their own device. Well, we have the voucher schemes, etc., but in the ESPP, it seems that this is not total privatization, but at least semi-privatization. You may have resources deployed in the voucher schemes, but then you have poor quality service, you have insufficient manpower to provide these services. Ultimately, elderly people suffer. When we talk about insufficient manpower, the government will reply, that's true, we're short of manpower. And, for other schemes for the youth, etc., they seek to groom manpower for the healthcare sector or the care sector. But then these young people would leave the industry because it's such a difficult job with low pay. And then the government would then say that instead of cultivating manpower, they should use the resources to take care of the elderly. In other countries, they do have financing arrangements for taking care of the elderly, such as a tripartite contribution. In Hong Kong, however, we don't want to touch on the interests of the conglomerates. We leave the elderly people to survive on their own. This is bogus consultation. This is the government being a miser, playing the drama of the king's, the emperor's new clothes, and the elderly people are really the victims.
Aging is certainly not unique to Hong Kong, and the term silver tsunami was not invented by Hong Kong. On the 26th of July, the Secretary extended this idea to Hong Kong, and there have been views on this. Now, Mr. Ng from the Grassroots Development Center, we have another delegation before that. Ms. Laika Mann from the DAB. Thank you. The DAB supports the Elderly Services Program Plan. As to how we actually implement this plan, how can we allow our elderly people to receive proper care? And this would rely on effective policy from the government, and community care services should be reviewed. There should be transitional care services, and there should be respite services. But these are only ideas. As for actual details, are there any timeline or review targets? Apparently, no such information is available, and the plan does not cover funding details. The government should conduct financial studies in order to come up with plans for the short, medium, and long term. Community care services would be key to elderly services in the future. Like other deputations said, for the engineering sector, they have faced constant manpower shortage. As for elderly residential homes, outreach teams, etc., there have been a shortage of carers down the years, and in recent years, the average age of carers has reached 50 or above. So we have elderly people taking care of elderly people, which is not healthy at all, and this is something we must tackle. As to how we can attract more talents to the elderly care sector in terms of remuneration, working environment, and so on, we must nurture talents. There must be an examination system, and elderly care technologies must be introduced. And the youth core of the DAB sees that as school fees for young people are very high, the government should work with education institutes to allow young people to attend courses before deducting the fees from their salaries, and this would encourage more young people to enter the sector. Japan entered population aging earlier than Hong Kong, and services have been provided to the elderly people by way of agreements, and there have been elderly care schools, and talents were nurtured, and there were innovations on care technology, and robots were also developed. I understand differences between Hong Kong and Japan, and we cannot completely copy their approach. But indeed, Hong Kong faces a silver tsunami, which is something we must tackle as soon as possible. And it's time to put our act together in order to allow our elderly to age gracefully. Thank you very much. Mr. Ng Kin Wing, thank you. Sorry for my coarse voice. I will try to share my thoughts, and as for this lengthy consultation, the Grassroots Development Center and other deputations have participated and spoken actively. 10 organizations wrote a very long submission to the Elderly Commission, and it has been shared with the panel. But I'm not sure whether the consultancy or Dr. Law has read this report or proposal, but having read this report, we are extremely frustrated, and I'd like to focus on 4 points. First of all, this is a closed consultation. During the consultation, the study team said they would only gather information based on the government agreement, and they dodged a lot of framework agreements, and they would only deal with procedural or technical issues. And secondly, they put up very lofty objectives, and they asked for public comments on aging at home, but they have ignored how we can build a sustainable and pragmatic care system. As for the and the third point is the outsourcing of responsibility. The team came up with a lot of assumptions in adjusting the service ratio. The responsibility has been shifted to the family members or the market. As for the means test, the provision of service vouchers include means tests, and this has gone against the idea of rewarding our elderly people. I think our elderly people have the right to be to age gracefully, but the very intelligent Dr. Law would talk to us about the definition of aging gracefully, or the definition of elderly. We have no hope for the current term government, but we will continue to ask the government to help the 38,000 elderly people who are on the waiting list, and we would continue to stand against any means tests. Thank you very much. So could our staff please give him a glass of warm water? He talked about a closed consultation, and thank you very much for your views. Mr. Chen Kaiping from the Elderly Rights Center. I'm also concerned about the 38,000 elderly people who are waiting for services. Apparently, the government has no plans, but they must have a long-term plan. For new public rental estates, could space be allocated for subsidized care homes for the elderly? Apparently, this has not been done. You can put in some resources. We asked you to build something, and you said you cannot find a space. So shouldn't some space be reserved in public rental estates during the design stage? this way, you can shorten the waiting time for those on the list, and you can allow elderly people to enter care homes as soon as possible. The queue is getting longer and longer, and the list seems to get longer by the year. So I wonder what the government thinks. I hope that I would get a place before I die. The government often talks about aging at home. As for public rental estates, apart from meals, cleaning services, medical visit services, or going to the toilet, if they are unable to do these, how can our elderly people age at home? The government must consider this, and the same goes for the secretary. And you did a lot of talking, but aging at home requires a lot of various support and services, and the same goes for medical services. As for elderly care, the secretary said they would not do anything. So how can you put our elderly people at ease? Even when services are provided, you require means tests, and you would vet their family members as well, and you talked about co-payment. So where is the government's commitment? Shouldn't you take care of these elderly people? And you fail to alleviate poverty. So how would you explain yourself? I think you should be more committed on elderly care and poverty alleviation. Thank you very much. As for the welfare planning in new public rental estate, it was discussed at earlier panel meetings. So this time we are focusing on elderly care services. So for the coming public rental estates like On Tat, On Tai, or Hong Fok Estate, at the service complexes, please let us know whether space is allocated for elderly care. So perhaps in a while the secretary can respond. Ms. Tai Ching from the Youth Retirement Protection Concern Group, Lord Chi Kwong said that young people are reluctant to enter elderly care. That's why foreign labor must be imported. So as a young person, I can tell you that young people do not just think about career ladder or salary. The attitude is equally important. The vice spokesperson of DAB said the government should subsidize young people in enrolling in relevant courses, and for the youth navigation scheme, part of the school fees can be reimbursed upon completion. But as Dr. Lau Siu Lai said, the number of people signing up is still very low. So it's all about attitude. People generally find this job unpleasant. So as carers and mothers, it's just like taking care of babies and children. They have to engage in a lot of unfavorable tasks like changing diapers or bathing. So mothers are really selfless. But why would people not think that carers are also selfless if they are willing to take up such work? Of course, it takes a lot of skill and patience to take care of elderly people, and Japan has set a very good example. And some Japanese carers were interviewed, and there are a lot of young people joining the field, and they all feel proud as carers, and they are able to take care of people who once contributed to the society. So they have a great attitude. But why wouldn't our young people think the same? The reason is the government has no respect towards elderly people and their carers. The care subsidy only amounts to $2,000. As for elderly care, the elderly welfare are only granted using the residual welfare, and there is no respect from the government. And the government keeps coming up with means tests. So whether for the care subsidy and service vouchers, means tests are needed. So young people are reluctant to enter the field. So what is the real reason? Law Chi Kwang often talk about high asset, low income elderly people. He often says that a lot of elderly people fall under this category, so there's no need for universal retirement protection. Many elderly people have a property, so they can take out reverse mortgage. I think reverse mortgage is a tool by the government to deprive our young people. If the elderly people mortgage their property to the bank, they can receive a sum or payment every month. But young people need to reverse the mortgage with market prices. So this is an obvious deprivation of our young people. So the government should not promote elderly policy in the existing approach. They should really respect the elderly people and allow them to age gracefully via universal retirement protection. Thank you very much. Carers in Japan are well respected, but why is that not the case in Hong Kong? If we import foreign labor, would the situation get worse or better? That is a crucial question. Ms. Lo Xiulan from the Elderly Services Users Concern Group. Good afternoon, members, friends. Today I would in 1997, Tong Chi Hua became chief executive, and he said the elderly people would receive care, but all he did was talk. Nothing was done. And by the time Donald Chang came, we asked for universal retirement protection, and he said it would not be affordable. So I think he was being too paranoid. As for CY Leung, I said you have to implement universal retirement protection. And he said there are many ways to do it. And at the end, he gave us $2,000 and pending to means tests. So he has not been very sincere. Number 4, for Carrie Lam. She said if universal retirement protection is implemented, young people would have a heavy burden on their shoulders. She's trying to create pressure on our young people, and luckily our young people are very determined and resolute. Our elderly people have no health, no money, and they are not getting help. So what can they do? So we must have universal retirement protection, and we must have elderly care so that our elderly people would suffer if they fall ill. Lord Chi Kwong refuses to implement universal retirement protection. Of course, you have no need for that. When you retire, you have plenty of money, and you will receive $70,000 per month. Of course, there's no need for you to worry. And Carrie Lam does not have to pay rents, so she's in a great position. So she has no conscience. All the none of the 4 chief executives ever help the public, and they only think about their own money. So I think universal retirement protection is essential. And you are giving students a lot of subsidy. What about elderly care? And many of them have to take care of their grandchildren until they cannot work anymore. And many of them have no money when they get old. All right. A lot of elderly people have to scavenge, and they were rolled over by cars. Do you know that you just sit there in your office? All right, we have heard you. Thank you very much.
Thank you, Madam Low, for evaluating all 4 CEs. Can we give Madam Low a cup of water? Yes, your microphone is off. Thank you very much. Thank you. Ms. Chairman White, Joint Alliance to fight for universal retirement protection. Thank you. I'd like to take this opportunity to respond to Dr. Lord Chi Kwong, the Secretary. She said on the 29th of September, after meeting with the Joint Alliance, that we expressed our views to him on Elderly Day, and then he said to the media that we hadn't read his 24,000-word document, and there was no rational discussion. I have to clarify. I must say once again that have you read this book? We have more than 100,000 words published in 2014 Hong Kong Stand-Up. There is only one thing in this book, what is meant by one pillar only retirement protection, and what is meant by universal retirement protection. In our meeting, you told us that we do have universal retirement protection in Hong Kong. You talked about pillar 0 and pillars pillar 0 and then 1, 2, 3, 4. Now, correct me if I'm wrong, Secretary. And we have presented you with 2 awards. First, creativity for sophistry. So universal protection, according to Dr. Law, is sum total of pillars 0, 1, 2, 3, and 4. In fact, there is no pillar at all. And then Dr. Law told us that, well, when we met, he asked us to engage in a rational dialogue. We waited for him for 1 hour. We were very patient. We asked him whether he was going to introduce universal retirement protection and when and how. However, we waited for an hour, and he finally told us that this term of government had no intention or plan to consult the public or to conduct a study, and of course there won't be universal retirement protection. So what's there left for us to discuss with him? So I must once again ask the Secretary not to tell lies. We wanted to present him with an award for universal retirement protection. You refused to accept it, and you told the media that we didn't give you the prize, so you were lying. I must clarify this. And lastly, apart from universal retirement protection, now the topic of today's meeting is elderly services. But if you don't even respect the elderly, how can you provide for them? When there is no money, how can people age in place? If you don't understand this very simple logic, if you have not read that 24,000 word submission from so many organizations, that's why you fail to alleviate the poor. And how come the waiting list for elderly services gets longer? Because you do not know how to define poverty. What is meant by poverty? When there is proper distribution of wealth, there is no poverty. But you have not really implemented any policies for fair distribution of resources. There is no financial protection for the elderly, and they cannot age peacefully in place. So we reiterate once again, please read this 100,000 odd word document, and also the 24,000 word document presented to you from so many organizations. There are 10 plan strategies and direction. Please read it so you can use our savings properly, so that our elders can age peacefully. You might as well present your document to the secretary. Yeah, I think he will read it. All right. Thank you very much. Ms. Kwang Shun-yi. Thank you, Chairman. Good afternoon. As a young person, and I also take care of my mother who has just received a surgery, I feel that the government is very insincere when it comes to elderly policies and helping the elderly to age in the community. They regard our elderly as a baggage rather than an asset. How can we ensure that our elderly can have genuine choices and that they can make informed choices? These are just very basic when it comes to respect for our elderly. Now you want to push residential care services to the private sector. You provide voucher schemes. You ask them to look for services, and if you don't like them, you can join the waiting list again. So you are not sincere in helping the elderly. When it comes to aging in place, you say that you have a meal delivery services and community care services. You talk as if there are genuine choices, when actually they have to wait for at least 8 or 9 months before they can be served. This is not about just placing our elderly at home and then it's mission accomplished. Because under the government's mentality, if you are institutionalized, everything is fixed, and once you're institutionalized, you have no hope of returning home. And if you stay home, then you can look after yourselves. In the long term, we need different types of services and interface to take care of different needs. For instance, my mom has just received surgery to her leg, and she required some level of care after the surgery, and as she gets better, rehabilitation needs changes, and there is also psychological changes, and even young carers like myself needs support. And have you considered that carers also need some respite? Is there any room to help different carers? For instance, can there be experience sharing among carers? So this is not just about sending somebody to visit the elderly person and that's it. Many of us have no siblings. Families used to be larger and siblings could share the burden. Now, one adult child has to look after his elderly parents, and we need support on all fronts, and there must be some space for such development. Elders are human beings. They have feelings and temper. So they are not just human being. When the secretary has time to look at them. So they are human beings at all times. Thank you. Thank you for telling us how a young carer feels. Mr. Feng, this concerned group for forcing elders to the market. Thank you. The number of elders in Hong Kong, according to the document, we have over 1 million, but it will soon reach over 2 million in the very near future. So we have over 2 million elders in society, and this figure will remain for more than 2 decades. So if I long enough, I will be among the 2 million odd elders in society. And in fact, elders are not a problem. The problem is they get older and older. There will be more and more elders over the age of 85, or even those over 100. So we have 1 million or so over 85 years old, but maybe 7% of them will be over 85 years old. So if I'm an elder, my son may also be an elder by the time he takes care of me. So youngsters are worried as to how should we fend for our future retirement. Carrie Lam talked about waiting, zero waiting time and aging in place. But in fact, there must be sufficient CCS so that elders can age in place and wait for services. Just said by some speakers, the average waiting time for services is 8-9 years. So there is no specific plan. When the elderly population increases, there is no plan to increase CCS, and it's not as simple as just putting money and adding new blood. And please don't think that the market can provide sufficient services within a very short time frame. And there is no specific long-term plan to provide the necessary services. They talk about plans, and the government thinks that once it is promulgated or once tried, then it is a real plan. But you have not told us how zero waiting time can be achieved. And for DECC, I learned from the internet that DECC are very small in area, and they have to provide different kinds of services, counseling, education, and outreaching services. One DECC is expected to do that. So there is only 18 staff members in one DECC to look after so many types of services, and they may have to apply for funding from different funds, and so they have more manpower, but they also have to provide more services. So you may think that there are plenty of services. Can we have a one-stop service so that one type of service can suit the needs of all elderly persons? I don't want this kind of voucher scheme and that kind of voucher scheme. I want the government to bear the responsibility so that even young people can feel secure for our elderly. After all, this is our right. The government should not only provide services when they have money. Thank you. Thank you. Please, thank you very much for telling us the dependency ratio for elders. In 2014, one will look after one elder, and then in 2064, it would be 1.8 persons are looking after one elder. Thank you. Ms. Mun Kai-yen, Chairman and members of Parliament, good afternoon. The government talks about importing labor to replace carers. I think there will be a lot of problems. There are elders with special needs, those who have suffered a stroke and also with dementia. Can import labor take care of them? Many families cannot afford foreign domestic helpers, and at home, we may not have room to accommodate an FDH. Rather than importing labor, can the administration consider enhancing the level of subsidies to carers? And there should be more publicity. For instance, the CCF is running a trial scheme, but is quite silent on that. And under the CCF, the subsidy is only $2,000, and this is far too low for a full-time carer. After it is a means-tested model in the market, if you want to find somebody to look after another person, be it a disabled person or chronically ill person, full-time, the lowest salary will be $18,000 per month. If the government can regularize the scheme and make it more comprehensive, there can be 3 benefits. First, you can take care of the financial burden of a full-time family carer because he has to leave his full-time job and devote his time to look after the elder or chronically ill at home, and this will mean financial burden for the family as well. And a carer will have to spend all his time with his sick elder at home. He will know the needs of the elder better than an FTH. Secondly, this will overcome the space constraint at home because many elderly persons live in PRH or small flats. It's hard to accommodate another carer. So there should also be a higher allowance and more support and counseling for carers. And you should not overlook the need for RCS. After all, not everyone can age in place. We need a multi-pronged approach in order to take care of our elderly persons. Ms. Lee Xianyin, now this is video tape recording. I can't be here personally. Please bear with me. Now, we can't feel secure for our elderly because the policy and the environment won't allow elders to plan for their future. They have no choice but to live in security in the future. For instance, an elderly man is already 70 years old. He's childless and his physical conditions are deteriorating, and he has to shop for a week's grocery, has to take care of an elderly spouse. He is now deteriorating, and he thinks he should find a social worker to queue up for RCS and also meal services. And then he's told by the social worker that he is not eligible, and even a stroke patient may not be eligible for RCS. How come after he is assessed that he is not eligible, he should still join the waiting list for RCS? That will add to the burden of the government. Let me tell you that this is because they want to plan for the future. They don't want to burden their family members. They want to look for services before they are too disabled. And then the elderly man I just referred to found out that he was not yet eligible. The government talks about respect and care for the elderly, but this is just paying lip service. Do you know how many elders are there and the crisis? You talked about the resources required. Is our government so poor? Of course not. The government is sitting on trillions of dollars in reserve. And yet the government would only invest in things they find it deserving, for instance, education, because CE said in a policy address that investment in education is meaningful investment for the future. And for elders, she's being miserly. The voucher schemes require means testing, and elders have to give up their privacy in order to receive this meager help they get from the government. That means the government, in effect, doesn't respect and care for the elderly. They regard elders as a burden. So it's not worthwhile to invest in elderly services at all. The government doesn't treat our elders as human beings. Lastly, I understand that Dr. Law will reach 60 very soon. He will soon be an elderly person. I'd like to present this voucher to him. We can pass it to him on your behalf. Thank you. Next. Mr. Chang Kai-fu, the Mutual Association for the Visually Impaired. Thank you. I'm almost 70 years old. I am an elder. Well, elderly persons face needs in clothing, accommodation, food, and also transportation. In particular, if you're visually impaired, you have more problem. Well, when it comes, I'm not really talking about clothing, but medical and healthcare services. When you reach a certain age, your physical condition will decline. Your decline in mobility and transportation. And it was once proposed that you will only receive dental care when you reach 80. I think by that time you don't have a single tooth left. How can you have proper diet? And then your health would be affected. So medical and health care and dental care are very important. Accommodation is also important. RCS and CCS. Now elderly persons live in very small premises. If the government has the money, why don't you spend more money to build more public RCS or RCHEs so that elderly persons can live peacefully with peace of mind and enjoy their 20 years?
They have been working hard all their lives. In their 70s and 80s, now they are being discriminated against by the government, and the discrimination comes in the form of screening and means test. It's very unfair to our elderly people. Is the government listening to me? And there is also mobility issue. For some elderly people in the 70s, they already have mobility problems. They can't even go to the elderly centers to have a chat or to take part in activities. We also have elderly singletons. These elderly people may be suffering from illnesses, and they may need the company to clinics for follow-up treatment, for grocery shopping, etc., and for more severe mobility issues. These elderly people may be wheelchair-bound already, and they need somebody to push the wheelchairs for them. Yes, we do have automatic wheelchairs so that one can move about without help, but the wheelchairs are very costly. And these elderly people are left to their own. So would the government please consider universal retirement protection so that each elderly can have a few thousands more, so that we can look after our elderly in the dotage? Thank you, Mr. Zhang. You talked about the daily necessities and the various problems encountered by the elderly in their daily lives. Thank you. You have something for the Secretary? Please be careful. Be careful. Be careful. Take your time. Next, Ms. Chung Pek Mui. Sorry, it should be Mr. Tam Nai Chung, Concerned Group on Employment Issues in the North District. Take a seat. Take your time. Thank you. Chairman. Over to you, Mr. Tam. Thank you, Chairman. In 2014, the government commissioned the Elderly Commission to devise a 3-year ESVP in order to enhance planning for elderly services. There are 3 stages. Aging in place would be the core, and institutional care as a backup. And in 2015, YEUNG's policy address follows the same line of thinking: aging in place as the core and institutional care as the backup. And in 2016, the Legislative Council endorsed the Elderly Services Program Plan with 4 directions. It is said that community care services will be enhanced, and we adopt the money follow the user concept, and there will also be means test. Elderly services will be privatized, and there will be a variety of voucher schemes for RCS, CCS, etc. You're helping the private homes. As for the CCS voucher, etc., elderly applicants are subject to means tests. There is a lack of places, and the waiting time is long. The government, instead of deploying resources to grooming manpower and also building more homes, the government privatizes the elderly services. In the waiting list, there is a majority of elderly aged 60 to 69. Most of the elderly people suffer from stroke and also other common diseases, diabetes, cataract, dementia, etc. Many elderly people suffer from chronic diseases. There are also elderly people who are wheelchair-bound and also bed-bound, and they need carers to help them with answering nature's call, cleaning themselves, the bed, tidying up the bed, and also using the urethra ducts, etc. And the carers may also need to communicate with the elderly people. They face a lot of pressure. They don't have enough sleep. They don't even take meals regularly. They feel helpless. They don't have their own time to take part in the social activities. They can't even have gatherings with friends. For those without means to hire a foreign domestic helper, the carer would be a direct relative. They may need to give up their work, and as a full-time carer, they lose their job. They do not have income. They face a lot of pressure, and in the long term, the carers themselves will also face depression and other illnesses or even accidents. A few months ago, a social worker resigned from his job to take care of his mother for 5 years. He was subject to so much pressure that he killed his mother and then jumped off the building. This is such a tragedy. We need to, the government should know more about long-term care needs, and yet we have the means test. The subsidy amount should be substantially increased. Or even for CSSA, the amount stands at 6,100. So there should be enhanced carers allowance. There should also be more RCHEs in different districts. And again, we should enhance the carers allowance so as to alleviate the burden on carers. Thank you, Mr. Tam. Family tragedies. Well, one case is too many, but I think we already clarified. You referred to the Huaixing Estate family tragedy. That person involved wasn't a social worker. That was a rumor, but it was clarified already. Next, Mr. Chu Wen-kun from a concerned group in Taipo. Thank you, Chairman. Well, I think basically other speakers already covered the points I wish to make. All in all, I want the government to set up a universal retirement protection scheme without any means test, without any eligibility criteria. Dr. Law, Secretary, if you could provide retirement protection at an early stage, you would not be facing such a huge problem with elderly services. Well, we talk about the advantages already, and let me tell you about the value of the elderly population in Hong Kong. They deserve respect. In Hong Kong in the 50s and 60s, the economy was still booming, and that generation worked very hard. They witnessed the success of Hong Kong. They strived to contribute to Hong Kong. They did not consider about their life after retirement. That is why I hope that the government could provide a basic safety net to meet the daily expenses of the elderly. I'm not asking you to provide aid or to alleviate them, to lift them out of poverty. It's just to acknowledge the contribution to society. Well, sometimes I met with elderly people scavenging for cardboards in the streets, and I explained to them that you have the old age living allowance, but the assets amount must not exceed $144,000, and they will be subject to a means test. And then the elderly people would tell me that they scavenge for a living simply because they do not want to apply for any allowance. It's just, say, $100,000, not a lot of money. This is so-called a coffin money that may help them tie them over, say, 8 to 10 years. So, Dr. Low, are those elderly people telling lies? They do have savings of $100,000, but would you regard them as rich elderly? Coming back to elderly services, well, if you have a screening, a means test mechanism, that's the problem. You provide services to elderly with physical impairment, and then with the introduction of a means test, elderly people with savings would need to procure service in the private sector, and this is unfair. All right, your time is almost up, Mr. Chu. About aging in place. Well, does it mean that you're going to import labor if there aren't sufficient workers? Next, Ms. Chongbik Moy, the Workers' Union for the Cleaning Industry. Thank you, Chairman. I'd like to talk about some cases and also whether the government has any long-term plan. For developing the caring industry. I received a phone call a while ago. I am a volunteer, and an elderly singleton rang me up. The singleton lived in Chengguano and asked whether I could help because the elderly tripped, and then I was engaged. I said that the elderly person should call, say, the ward office of a district councillor or get some other help. And that was an urgent case. Eventually, nobody responded. Everybody said that they were busy. So does it mean that we do not have a long-term plan to help those in need, urgent need? Because the elderly person tripped at home and couldn't walk, and he was asking for help. He needed some urgent help for, say, meal delivery or for a visit. But ultimately, nobody went for a visit. I rang the district councillor. In that case, nobody went. And then I asked the elderly, did anyone come? And then the answer was in the negative. In another case, well, it's actually the elderly day last year. Again, I was asked to help, and then I referred the case to the Council of Social Services. Again, the request was about a visit or meal delivery. Nobody helped. So in terms of carers and home care service, is it the case that the social welfare sector in Hong Kong cannot really allocate resources to give more care to these elderly people? About residential care homes, again, a lot of elderly applicants have been on the waiting list for a long time, and they died before they got a place. They were still on the waiting list. We have a lot of money allocated for different uses in Hong Kong, but for the long-term program plan, I don't see the sincerity in really promoting elderly services. I think that the Hong Kong government should plan for more carers and build more residential care homes. Don't ask people to buy a place in the private sector. They're expensive. They're beyond the affordability of the elderly. Well, thank you for reminding us that the Elderly Day isn't just the 19th of November. Every day should be the Elderly Day. We should have them in mind. Next, Madam Chu Mun Chen, concerned group of carers. Thank you, Chairman. According to the government officials, aging in place is the idea, but once an elderly patient is discharged, they will only be given a pamphlet listing the private homes for them to find a place. Many elderly people feel isolated, and upon discharge from a hospital, many families could not take care of the elderly people, and that is why they will be sent to a home. That is because you do not do the one-stop service well. After elderly patients are discharged from the hospital, there is no respite service or halfway hostel for elderly people to recover and recuperate first before they are returned home, so that the family members can look after them. And some families may not have the knowledge. They may send the elderly family member to a private home, and the service of the private homes is substandard and it is costly. And you cannot address these two problems. Residential care home voucher scheme and CCS voucher schemes, they are all subject to means test. Just now, Ms. Mkayan, who spoke, talked about the feelings of carers. Well, applicants face the pressure because of the declaration and the means test. The applicant will be required to submit bank account information, etc. They are already muddle-headed, and they will face criminal liability if they make any mistake in the declaration. So many eligible elderly people are deterred from applying for help because of this problem, because they are not good with numbers, they're not accountants, they do not want to go through the fuss. Universal retirement protection is the best help for our elderly. On one occasion, I heard on a radio program, Dr. Lo Chi Kwong, the secretary, said the following. Poverty alleviation cannot address the problem. But does it mean that we should stop poverty alleviation work? Well, Dr. Low actually was putting words into the mouth of the public. But did you hear the public clearly? Poverty alleviation by itself cannot address the issue. Universal retirement protection can prevent poverty, however. You need to do poverty alleviation, but better still, you need to prevent poverty by having universal retirement protection. Mr. Chen Chao-sing. Concerned group of the security guards of standalone buildings in Kowloon, Mr. Chen Chao-sing. Thank you, Chairman, Secretary. This is the first time we meet. This is the third time we meet, actually. And we may meet again in the street. Well, back to my point. It's been 20 years since Hong Kong is reunited with China. But in terms of our elderly policy, we are staying put. As the Secretary said just now, we do not have much progress. One needs to wait for a certain amount of time before one is allocated with a place in a public residential care home. And we are lagging behind other similar countries. Hong Kong is a metropolitan city, but we are faring poorer than other international cities. We're the laughing stock. The SAR government always tells us that we have mainland as our hinterland and we need to have the global vision. Now, on elderly policy and universal retirement protection, mainland is doing quite well. Taiwan, Singapore, Japan, these neighboring countries, and Japan in particular, has quite a good elderly policy. And even farther away, Australia, New Zealand, Germany, these places also have very good services for the elderly. In Germany, in particular, the private residential care home is as big as Fairview Park. And they also have around-the-clock care provided by their staff. Whereas in Hong Kong, when we talk about publicly run residential care home, the government always says that we're short of land, etc. But that's not true. According to the media, in fact, we do have sites. For the Tonghua site and along Caroline Road, we can build a residential care home for the elderly there. And we also have a lot of vacant flats. Once converted, they can be put to better use.
These buildings can be found in Shan Shui Po, To Kwa Wan, Kwun Tong, Tai Kok Tsui, and Sai Wan. I think we can talk to Mr. Tian about these buildings, and we can talk about annual rents or rental period. This can be a solution to the long waiting list. That way, we can shorten the waiting time. As for the loss of carers, the government must pay some responsibility. Carers have very low salaries and they have poor working environments, and there's also a lack of training and prospects, and that leads to a heavy drain, and there's no long-term plan or a holistic plan, and the chief executive does not have a policy on this, and there's no real solution. And they always talk about money follows the user. Do you know that the government's policy is actually torturing elderly people? You talk about money follows the user, but do you understand how it works? Medicine costs money, medical visit services cost money, so everything is not free. Do you know about the abuse of or overcharging? Please be quick, Mr. Chen. I'm coming to an end. You fail to give justice to the elderly from the elderly home incident and the elderly suicides. You fail to give them justice. Thank you very much. I remind deputations that we do not want you to give presents to the government. So for deputations in the next session, if you intend to give presents, please let us know ahead of time. 26 deputations spoke in the first session. As for the community care fund pilot scheme or the planning ratio or the CCS or privatization of services, as well as consultation of the ESPP or the carers or social workers, as well as the planning of new estates, the navigation scheme, etc. Deputations have spoke about all these issues. So they also talked about carers allowance or dental subsidy. So some issues have sprung up time and again. So we now invite the Secretary to respond. After that, we would open up to questions from members. Over to you, Secretary. Thank you. I will try to avoid repeating what's been said in the past. A number of deputations are in their comments are incorporated into the plan. If you have read the consultancy report, well, the report was uploaded by the Elderly Commission. The latter part of the report incorporated views collected during the consultation, and a response to the views are included on the annex, and you can find that document on the Elderly Commission website. I think I can give some examples from that report. Some deputations talked about the hospital leaver support services, and the current integrated services can only help the high risk or vulnerable elderly people who are readmitted, and the carers cannot receive such services. So that's why we have a pilot scheme to provide transitional care support. So I won't repeat the details here. Some deputations also talked about care services for the mildly mentally handicapped, and there is another pilot scheme. And some deputations talked about elderly people with mild impairment and the need to provide services. As for the dementia support scheme for dementia patients, during the consultation, we looked at the situation. So before the plan was published, we had started a pilot scheme. Of course, the list goes on. I often give this example. Take this glass of water as an example. We have heard some of the views, but I think the focus should be on the views we have heard rather than the opposite. In the 2017 to 18 budget, in the budget speech, $30 billion would be earmarked for rehab and elderly services, and the $30 billion will cover non-recurrent expenditure. In her policy address, the Chief Executive mentioned funding items relating to the $30 billion. Of course, the $30 billion is not used up yet. For example, the $1 billion in gerotech encourages elderly care service providers to use gerotech to enhance their services. We hope that deputations and the public, well, I do not wish to repeat the same words, but in order to illustrate my reply, I must state those words again. The government has never said that the elderly people are a burden, and the Chief Executive said that elderly people are not a burden. So I hope we should not talk about elderly people as a burden. As for the silver tsunami, we are just referring to the fluctuations in elderly population. When you look at the projections, you can see the big fluctuations. That's why we need long-term planning. That's why we have to embrace the challenges, but we should not see elderly people as a burden. In terms of services, manpower shortage is of course a major challenge. I hope we don't always talk about elderly care services as an undesirable trait. Some practitioners told me that they feel fulfilled interacting with the elderly people, and when the elderly people smile, they would feel satisfied. To achieve that, there's a lot we have to do, and we need a multi-pronged approach before we can improve the situation. For example, we need to enhance the work environment, manpower shortage, and so on and so forth. That way we can allow practitioners to feel fulfilled. There are a lot of inadequacies to be improved. As for the planning, I won't repeat the details or the formulas. Since 2003, Hong Kong planning standards and guidelines have removed the ratio of welfare facilities. So we need to incorporate the ratios of welfare facilities into HKPSG again. One advantage is that we can commence the work as soon as possible. A lot of planning requires a long time. Early this year, a service unit, which was an elderly home, had an opening ceremony. And in 1999, there were planning standards, but the standards were lower than what we propose. And in January 24, services started. And early this year, there was an opening ceremony. So if we do not begin our work early, we will face greater challenges. 6 to 7 years ago, even without planning standards, the social welfare department offered to introduce more service units. So we will have elderly services coming up. But in terms of the rate of increase, there's still some way from our target. So in the coming years, we face a lot of challenges. The reason is that the number of service units planned years ago were inadequate in meeting service demand. That's why we need to improve our planning efforts. And this is a big problem, especially in residential homes for the elderly. So how can we secure 100, 200, or even 300 service places? We will do our best. So that's all. There are a lot of different views, and some of them were incorporated into the plan already. Thank you very much. Now the floor is open to members. Dr. Fernando Chang, 4 minutes. Thank you. I'd like to thank the deputations for being here. Today we have elderly people as well as young people, and you have given a lot of different views. A lot of deputations were very well prepared. Well, I cannot name all of them. The ESPP, for example, the ESPP petition, which spans more than 20 pages, and there are 10 strategies. Well, it was very meticulous. Compared with the consultancy proposal, that petition is much more complete. I think a program plan must address the existing shortfalls and future needs. As for service projections or needs, the Secretary did not address the views of many deputations. One of the deputations asked why the service need projection would actually decrease despite the silver tsunami, which is unimaginable. Since aging at home is the focus of the policy, community care service should be greatly enhanced so that our elderly people do not need to stay in elderly homes. But in terms of planning, this is not the case. The Secretary talked about HKPSG and your proposed service ratio. The ratio of RCS is higher than CCS. So you talk about aging at home, but you actually plan for more CCS or RCS. And there is a lack of concrete figures. There are no hard indicators to show how you can reach your goals. For example, aging at home or zero waiting. Well, zero waiting is not part of the plan, but as the Secretary and Chief Executive both talked about it, how can you achieve zero waiting in your plan? So, Secretary, you went from consultant to Secretary. So how can you achieve zero waiting through this plan? Is there a plan in place? I do not see how you can achieve zero waiting. According to the latest figures, more than 38,000 people are waiting for residential care homes. As for those waiting for CCS, there are more than 5,000 frail persons and 4,000 waiting for daycare places, for a total of more than 9,000. They have been waiting for years. For daycare centers, 10 months, integrated home care, 10 months, subsidized care homes, 38 months. Thousands of people pass away while waiting. We hope the Secretary can tell us how you can achieve zero waiting and what is your plan? Can you allow all needy elderly people to age in place? Your time's up, but since no members are waiting, can the Secretary respond to this question on the issue of zero waiting? It was mentioned in the policy address. What plans does the Secretary have? Chairman, if I'm correct, we discussed the issue of zero waiting for more than half an hour in an earlier panel meeting. So I do not wish to repeat these points, but I need to clarify some issues. Dr. Fernando Cheung said that under the program plan, we are suppressing the demand, and the demand would go down despite the silver tsunami. In an earlier Welfare Services panel meeting in July, the overall demand is rising, and it's rising rapidly. So you should not distort the demand of different age brackets. And I understand that these figures are somewhat complicated, and we would use specific examples to illustrate the point at a forum. And Mr. Lau Tin-Chang or Dr. Lau Tin-Chang explained the situation, so you can refer to his PowerPoint presentation. Under ESPP, for the overall care service need for CCS, the demand is rising rapidly. For the ratio of RCS to CCS, I think I have addressed this question at least twice in the past. In terms of domestic assistance and day care compared to residential care services, while the ratio is 1:3, in the next 10 years, we want to achieve a ratio of 1 to 1.5. Those in residential homes are already there. We cannot remove those people. So we must continue to increase the places of RCS. So that's how we can improve the ratio. On the long run, the target is 1 to 1. So in terms of aging at home, the biggest service provider is often family members or domestic helpers. Our subsidized services are only the third supplier. For subsidized care homes, if we are to help frail elderly persons, we need to increase places in public elderly homes.
And we do not effectively ensure that the demand for long-term care at different age groups to be reduced or relieved, then the objective outcome is in 2037 and 47 we have to build 37 RCHs. So we must do our level best to lower the demand for long-term care. This will be done by means of prevention and early intervention or identification. And of course, in due course, we have to increase the number of RCHs, and in the long term, we hope to lower the demand for long-term care from elders. Thank you, Secretary. I have a question, but as I said, we will try to be punctual as far as possible so I can perhaps the administration can provide written reply to me afterwards. Mr. Zhang Kaiping, who was left, right, he's still here. He asked a question about elderly services planning in new housing estates. Now, from the 1st of January 2017, the 2 years to follow, what will be the plans for elderly services in PRH estates? I know that in Ongta Estate there will be an RCHE in social welfare complex. This is the only one I know. I just want to know whether elderly services facilities will be planned to be provided in PRH estates. In fact, we have provided information to the Welfare Services Panel the supply of service units in the future. If you want an updated version, we can provide that in the future. In fact, new PRHs were planned before 2003. So back then, there was no plan to provide elderly service facilities in PRH estates. So starting from 2 to 8 years ago, the FSD has been doing this. Whenever there is any opportunity for elderly services facilities to be provided in government buildings, the WSD will try to utilize that. Now, for untapped estate, in fact, the one you refer to is not within untapped estate; it's outside. I'm sure there will be service units there, but using the current planning standards, there is still some departure from the planned standards. So the PRH estates completing around this time were planned before 2003. And some of the facilities were taken away. And as for when, I cannot give you a specific answer now. But for some of the PRH estates, it's true that the facilities provided would fall short of our expectations. So can you tell us, in 2018 onwards, in the coming 3 years, what new elderly service facilities will be delivered or being implemented? I'm afraid time is up for our first session. We'll take a short break of 5 minutes and we'll start after 5 minutes. And Mr. Roy Korn, our Deputy Chairman, will chair that session. I want to thank the deputations and individuals who have spoken in this session. Thank you.